Thank you, the Hindi team. Good evening, good afternoon, and good morning. This is the 1847th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Professor SAMAR CHATTERJEE. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, a local Malaya session in local language session in Malayalam. We are uploading the videos on the very next day itself, so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with anyone who loves homeopathy, whether it be a student or doctor or a homeopathic lover. And the purpose of the Zoom is that to promote homeopathy among public and take homeopathy to every home around the world. And as you all know, the International Forum for Promoting Homeopathy is celebrating its 5th anniversary on 28th September at Cochin, Vivanta. And there are many sessions in this forum, and it is a very fine session. It is going to be a big session, and the inaugural ceremony will be done by our Aish minister, and thereafter there will be a short presentation, then some 20 minutes presentations, and there will be a presentation on dental homeopathy, veterinary homeopathy, and agro homeopathy. At the end, from 3:30 to 6 p.m., we have a cultural session program also. Kindly register for the same, and those who missed the registration can register now. The amount is 3,000 per person, and if you are coming with an accompanying person, you can pay 5,500. So that's all about our celebration. Just a week to go for that. I hope all of you will come and join us, and we will be making a special promotional videos, and we are uploading some of them among you. So kindly share it with your friends as well as others also, so that more people will watch it, and some may come to our sessions also. Today, as you all know, Dr. SAMAR CHATTERJEE MD is a professor and HOD, Mathematical Department of JIMS, Homeopathic Medical College and Hospital, Hyderabad, Telangana. He is an examiner in UG and PG, paper setters, moderator in different universities, and member of a drug proving committee at JIMS Homeopathic Medical College, organized by CCRH, published articles in different journals, reviews, and books. Practicing homeopathy since last 39 years and have a teaching experience of 34 years. Today, a doctor will be talking about From Suppression to Expression, a homeopathic journey with Staphysagria. And we will have a... So I apologize for the mistake. There was some technical problem from my end, from our part. There was a network problem with me, and it's over now. And already the introduction is over. I'm proudly welcome the guest of the day, Professor SAMAR CHATTERJEE, to this session. Welcome, sir. I can make you co-host now. Please wait. Okay, sir. Now we can begin. You can share the screen also.
Share the screen. Share. You want to screen?
Sir, in the middle. Okay, sir. It's visible now.
Good evening, sir. Namaskar. Respected, distinguished guest and Dr. Dhanesh, Dr. M.K. Sahani, sir, Chairman, sir, senior faculty members. I would like to extend my gratitude to respected members of the International Forum for Promoting Homeopathy, and special thanks to Director of GIMS Healthcare, Dr. Nobin Pawaskar, Principal Dr. Dhole sir, and HMM Department faculty, Dr. Benu Sharma, Dr. Kipti Lopsi, and all the HMM teachers and all the teachers of the GIMS Homeopathic Medical College, and my dear all undergraduate, postgraduate students, respected practitioner, and all the respected audience. Today's webinar, Suppression to Expression, a homeopathic journey with Staphysagria, aims to explore the therapeutic potential of this remedy. I thank the organizer for providing a platform to promote homeopathy and connect professionals worldwide. Now the historical use. The Staphysagria is a plant kingdom. Drug is prepared from the seeds. And the application of historical use, application of this was in existence evidently in domestic practice for toothache, seasickness, remedy for removing the habit of masturbation in young subjects, also for removing abnormal appetite in adults. In ancient times, Staphysagria seeds were used to treat lice and scabies. In 1800th century, its calming effects on emotional disturbances and physical trauma gained attention in homeopathy, especially for conditions linked to emotional insult or repression. Now the clinical condition, the clinical utility by this Staphysagria, how we will utilize the different disease condition like adenoids of the child, angers, fits of angers, condylomata, cough, cyst, dentition problem, dysentery, masturbation after effects, gastralgia, rheumatism, sciatica, scurvy, seasickness, warts, and spermatorrhea. Now, you see, we know that recently National Commission of Homeopathy of India, they have recommended the CBDC syllabus, competent-based dynamic curriculum. In that, we have to study, the teacher must train the students regarding the integrated relation with the drug. So now I am going to say about the integrated relation with the Staphysagria. With anatomy relation, acts on urogenital tract and bladder, urethra, then mucus, membranes, periosteum, and joints. In physiology, you see, disturb autonomic nervous system and bladder irritability and sexual overindulgence and weakness. In biochemistry, alters alters neurotransmitter balance, uric acid metabolism, gout, inflammatory mediator imbalance, cystitis, wounds. If we want to get relations with the pharmacy subject, you see that source Delphinium, Staphysagria under the ranunculus family, we know, contains delphinin alkaloids toxic in crude. In forensic medicine and toxicology, crude plant poisonous causes vomiting, burning, delirium, cardiac respiratory failure, historically used as insecticide and pediculicide. Now, regarding the preventive and social medicine relation, integrated relation with the Staphysagria, used in lice, scabies control, role in mental health, psychosomatic illness due to suppressed anger, supportive in post-operative recovery, integrative medicine. Now, regarding the relation with the pathology and microbiology with the Staphysagria, indicated in chronic cystitis, prostatitis, uveitis, warts, styes, boils, prevents post-surgical infections. Now, regarding related with the practice of medicine, covers chronic urinary tract infection, psychosomatic disorders like anger, humiliation, grief, nervous system complaint like headaches, neuralgia after emotions, gouty diathesis, and skin eruptions. Now, related with the integrated relation with the os and gynae subject with the Staphysagria, useful in vaginismus, painful coitus after trauma and abuse of sex, cystitis in women, postpartum healing after cesarean section, episiotomy. Now, the integrated relation with the surgery, known as knife remedy, that is Staphysagria, relieves post-surgical stinging pain, helps wound healing, prevents post-operative infection, useful after catheterization and stye excision. Now, they insert the ailments from what is the causation. You see, the pride. Pride is a cause. Envy is a cause. Insulting by some other. Indignation. Dentition trouble. During dentition. Excess use of tobacco. And after surgical interference. Surgical operation. Now I would like to express about the guiding characteristics. This is the basis of prescription that I am going to express. Great indignation about things done by others or by himself. Anger with indignation, mental and physical effects of onanism, sexual abuse or sexual excess, constant thinking of sexual desire. Great nervous weakness, weak memory, does not like to do any mental and physical labor. Next, guiding symptoms, extinct appetite even when stomach is full of food, or bad effects of injuries from sharp cutting instruments and post-surgical operation. There is an intense craving for tobacco. It is also most important characteristic symptoms of Staphysagria. Eczema with acrid oozing, new vesicles from contact of the exudation, sleepy all day, awake all night with body ache all over. Next guiding symptoms is cough only daytime and cough aggravation by toothbrush, cleaning the tooth, sensation round ball in the forehead sitting firmly there, even after shaking the head, it is not removed. So it's a peculiar illusion. It's a sensation that is there is numbness in between two eyebrows in the gavella area, sensitive to slightest mental impression, least action, every harmful words offends the patient. Toothache during menses, teeth are very painful to touch a food or drink, not from biting, aggravation drawing cold water in the mouth. Now, I would like to express about the soric, miasmatic, psychotic, and syphilitic symptoms which are present in Staphysagria. Basically, Dr. Kent said that the Staphysagria having 3 miasm, but most of the authors, the scholars said that sora and psychosis is the predominant in Staphysagria, and syphilis also superadded. And that's why I am telling you initially the soric symptoms. What are the mental symptoms of the Staphysagria? First is hypersensitive to least word, mortification, indignation, and the silent grief, suppressed anger. These are the under soric symptoms. Nervous exhaustion, ill effects of suppressed emotion, chagrin, sexual excess, nervous irritability, excitable yet weak, sensitive to rudeness, contradiction, hypochondriacal, fearful even of his own shadow. This is the mental symptoms, soric symptoms available in the Staphysagria. Next, the physical symptoms of soric miasm. The physical symptoms present in case of Staphysagria soric symptoms, that is headache after suppressed anger or mortification, eyes sunken with blue rings, itching and burning of eyelids, soric irritative, recurring, non-destructive eye troubles, diarrhea after cold water, burning in urethra, eczema, dry and itch, colic after anger, skin scratching causes change in place of location. Now I like to express about the psychotic symptoms of the mental variety, sexual sins and excess. As per body, sexual sins and excess present in case of Staphysagria, dwells on sexual matter, prefers solitude. And physical symptoms, there is styes, nodocytes, chalazion on eyelids, polypy of conjunctiva, styes remain as a hard nodule, dry pedunculated figures, cystocele, arthritic nodocytes on fingers, and gouty nodocytes. Now the syphilitic symptoms also present in case of, if we study the various Mathemedica, the stalwarts, Mathemedica, I mean the source books, then we can understand that some symptoms in favor of syphilitic symptoms also there. That is the mental symptoms, violent temper, uncontrollable passion, dexterity impulse. It is usually happened after long time torture, and the mental suppression. Ultimately, the patient is outburst and having the destructive impulse, not so severe like nitric acid, not severe like carcinosin, but it is also there. Chronic irritability, gloom, persistent anger, suspiciousness, imagines he is despised, insulted, or that he will lose his fortune and he lost his wife. Residual effects of prolonged suppressed emotion and anger, these can be supporting the syphilitic symptoms. Now I would like to express about the physical symptoms in favor of syphilitic symptoms, miasmatic symptoms, caries of cranial bones, and the chronic syphilitic iritis with busting, burning pains, recurrent styes and blepharitis with.
As you all know, the International Forum for Promoting Homeopathy is celebrating its 5th anniversary on 28th September. That is on coming Sunday at Cochin. And we will have a lot of things during the presentation during that day. Hope all of you will register for the same. Rupees 3,000 per person, and for this we are arranging lot of important subject, particularly agro-homeopathy, veterinary homeopathy, as well as dental homeopathy, cancer and homeopathy, then homeopathy in autism. So all of you may come over here and register. Okay, sir, is back.
So now what I was telling about the syphilitic symptoms, the physical symptoms of the Staphysagria, the caries of cranial bones, chronic syphilitic iritis with bursting, burning pains. Sir, I'm audible? Hello? Sir, I'm audible? Okay. Recurrent styes and blepharitis with thickened lids.
Yes, everything fine, sir. You can go
Yes,
ahead.
okay, thank you, sir. Chronic supporting submaxillary gland swelling, abscess formation, teeth is becoming black, loose, decayed rapidly after eruption, tremble easily, painful, tender, caries teeth with fistula details, pyorrhea with pale bleeding gums. Now next is evaluation. Evaluation of child. First, I want to express that one, the child mental cause. Vexation from strict parents, not allowing to play with other children leads to suppressed pleasure. And the child is tremendously sensitive to teasing from peers, comparison by parents, or criticism by anyone. Slightest negative comment makes him deeply hurt from a young age. He begins to suppress his emotion instead of expressing what he feels. Great indignation about the things done by others or by himself. This characteristics sentence line we got from the Alan's keynote. Next is was insulted after scolding by parents or by teachers, being too dignified to fight, subdued his wrath, went back home sick. This drug is adapted to the child who are pot-bellied, ill-humored, cries due to pain as child is very sensitive to physical impression. After lacerated injury, cut injury, after any surgical interference. Next, the expression, how it expresses. Child is usually friendly in a healthy environment, but as soon as he is in unfavorable circumstances, he recoils into self. This leads to the hypersensitivity gets easily hurt, is anxious all the time, and suppresses his emotion. Child is good at studies. He intelligent, but after an insult, child cries, petulantly pushes others, throwing the things, was too dignified to fight back, and then went back home and become sick. And the trembling started, nervousness, does not sleep, awake all night, loss of appetite. After lacerated injury, cut injury, after any surgical interference or operation, leads to pain in abdomen in the child, and that causes loose stool. Child cries with pain. Continue. Shall I continue? Yes.
Sir, some
yes, sir. Child
Yes.
cries with pain, very sensitive to mental and physical impression. Child goes away from every wry look, disgust in face, harsh words, and cries from least pain. Child becomes cross and irritable due to pain. Spasmodic cutting abdomen after eating and comes. Sleep all day, awake all night. Child awakes, pushes everything away and wants everybody to go away. Is unmerited insult, grief confrontation, indignation, reserved displeasure, suppressed anger, and mortification. Tobacco excess use.
Again, this slide.
The previously.
Yes, previously.
Next, I am repeating the previous. Physical cause, mechanical injuries, sharp cutting instrument, post-operation, onanism, tobacco excess.
Yes.
Net adolescent evolution. The sensitive child becomes romantic, and if his feelings are not reciprocated, there is an extreme disappointment. There is a tendency to masturbation filled with increased sexual thoughts, leads distress and physical disturbances. He is cautious about what others think about him, and so always dresses well and is polite. Again, the slightest criticism from friends annoys him, but dignified to express that anger and suppress it, leading to physical symptoms. Now, adulthood evolution and delicate sensitivity and vulnerability weaken him from within so that it is difficult to face stressful situation. It develops to great violent internal anxiety, dreads the future, is quite self-indulgent, and will not deny himself the satisfaction of his emotional and sexual urges. Now, expression. Mentally, subconscious anger comes into the picture. They attach themselves to the present circumstances, generates an endless resentment, bitter indignation. But bitter indignation is prominent in afternoon. Staphysagria, here it is not so prominent. It is little bit is there. But bitter indignation prominent in afternoon. Then towards the person who rejected him of the cause leads to outburst due to past anger. Then about
This network failure, sir. Okay, sir, it's fine. It's fine now.
okay.
Go ahead,
Ah.
sir. Some network problem with your
Shall I
connection.
continue, sir?
Yes, sir. Yes, sir.
Yes. Chest operation of
International Forum for Promoting Homeopathy is celebrating its 5th anniversary on 28th September. That is coming Sunday. And the chief guest to inaugurate the session is none other than Honorable Sri Jadav Prathavro Ganavathro, the Honorable Minister of State, Independent Charge, Ministry of Ayush and Family Welfare, Government of India, New Delhi. So, hope this will be a big session for us. It's a live session. It begins at 8 a.m. and ends up with 6 p.m. There are many things arranged for that, and there will be some eminent personalities also talking in the inaugural session. there will be some scientific presentation on cancer and homeopathy, autism and cancer, skin surgical conditions treated with homeopathy, and then veterinary homeopathy, general homeopathy, and agro homeopathy. All these things will be discussed by eminent personalities from all over India. And we have international participants also coming over here to participate in the celebration. Those who want to participate in the celebration, please register at our website as well as personally to any one of us. We have shared the links of in our group where to join, where to register, where to pay the amount money. As you know, it is 3,000 per person. And if a person is accompanying them, definitely you have to pay 5,500. Such network problem is weak. That's the reason why there is some interruption in between. Please continue, sir. If you are, the network is okay. This is a problem with our Zoom session. Sometimes there may be some interruptions from because of network failure or power cut. Otherwise, most of the days we have good. Yes, sir. Sir, yes, sir. You can share the video now, sir.
Sir, give me, sir, audio. Audio.
Yes, sir. Yes, sir.
And now the next problem is the chest operation, dyspnea and cough aggravation during day and cleaning teeth. And in male sexual organs, loss of prostatic fluid, impairment of sexual desire, pain in testicles, itching of scrotum, atrophy of testicles, backache, nocturnal emission, face sunken, and that is the Abbas loop. Bladder irritation, urge to urine. Now adult females. Now I'm talking about the adult females. You see, the constipation, bowels act once a week, hard stool, round, dry, comes away like dog's pieces. And there is a urinary trouble, frequent urging to urine, especially newly married people, after labor, honeymoon cystitis in case of new married couple. And after labor, there is a cystitis and urging for frequent urine, get irritability of bladder and urethra, nymphomania, due to which there is pain in ovaries, sensitiveness of vulva and vagina, menses irregular, late and profuse, first blood, pale, then dark and clotted, stinging, itching of vulva following the operation on ovaries. Now I am telling about the old age. Old age mental cause, onanism, insult, domestic affairs, mortification, and physical causes operation, post-surgical problem. Evolution is they respect people and are careful enough not to hurt anybody in order to not to get hurt themselves. But they also gradually go into the state of depression in the old age of Staphysagria, which further erodes their will and inner strength. Eye, laceration of cornea with prolapse of the iris after operation for cataract, and face, prosopalgia of old female on touching spoon or fork to lips, inexpressible pain shot from lips over face. And in urine, in the old age female, pain, male in old male, painful emissions of urine due to prostatitis, frequent emission of red urine, involuntary urine during coughing in case of male. Male sexual organs, chronic prostatitis in old men, pain extending from anus along urethra, it is going upwards from rectum to upwards, very marked increase of sexual desire with frequent erection at night. It is a abnormal symptoms in case of old age. female sexual organs, prurigo, senilis, itching, or from parasites, induration of sexual organs after unmerited insults, hardened tumors due to suppression of emotion, and sleep is disturbed, sleepless after disappointment and grief. Now, I would like to express that compare with the Staphysagria with other drugs. Staphysagria, Natramur, Causticum, Naxomica, Lachesis, and Pulsatilla. So main theme of Staphysagria is suppressed anger and mortification and indignation. In case of Natramur, silent chronic grief and emotional isolation. In case of Causticum, the injustice, idealism, and deep sympathy for others. In case of Naxomica, overwork, over mental and physical work, stress, and hypersensitivity. In case of Lachesis, jealous, suspicion, and loquacity. Pulsatilla, changeable, mild, and yielding disposition. And in case of Ignatia, emotional shocks and contradiction. Next is mental emotion. In case of Staphysagria, easily offended, throws things when angry, but suppresses and subdue the wrath, control the anger, ailments from indignation or sexual suppression, dwelling on past grief, reserve weeps alone, hates consolation, Natramur. In case of Causticum, sympathetic, idealistic, anxious about others, and hopelessness, fight for others. Naxomica, irritable, fault-finding in nature, impatient, type of personality. Lachesis, very much talkative, jealous, suspicious, and sarcastic manner talking about behavior. Pulsatilla, weeps easily, needs consolation, and timid and gentle. In case of Ignatia, patient is sighing, long sigh, sobbing, contradictory moods, silent grief. Next is anger reaction. In case of Staphysagria, silent, keep it in mind. Latter outburst sometimes, after a long time. And in case of Natramur, suppress emotion, weeps secretly. In Causticum, anger about injustice, fights for others. Naxomica, explosive anger, throws things. Lachesis, angry, sarcastic, biting speech. Pulsatilla, rarely angry, weeps instead, needs consolation. And in case of Ignatia, sudden outburst, then regrets. After outburst, then regrets. And key physical symptoms of the Staphysagria is ties, chalazion, teeth problem, blackish teeth, crumble, teeth decays, honeymoon cystitis, surgical wounds. In case of Natramur, physical symptoms mainly headaches like hammering, maps tongue, vesicular eruption, constipation with dry stool. In case of Causticum, physical symptom, main theme is paralysis, contraction, warts on face, and rawness in throat and cough. In case of Naxomica, gastric issue, always having gastric problem, constipation, alternate with diarrhea, indigestion, ineffectual urge for stool, and at night is sometimes hangovers. Lachesis, in case of that is left-sided complaints usually started, and it affects in the menopausal syndrome, easily menopausal time, it is usually affect menopausal period, intolerance of tight clothes. And in case of Pulsatilla, thick blunt discharges, varicose vein, and shifting pains. In case of Ignatia, spasmodic pains, globus, hystericus, and yawning. The modalities of Staphysagria after stool, warmth rest, Natramur, open air, tight close, better. Patient is better in open air, Natramur, tight close and loosen. Staphysagria after stool, warmth rest, better. And Causticum, damp weather, feels better. Naxomica, rest, warm, palm pressure. Lachesis, discharge, warm application. Pulsatilla, open air, and sometimes cold application. Ignatia, walking, change of position. Aggravation in case of Staphysagria, emotional and humiliation after caution and after anger. In case of natamute, sun heat, consolation aggravation, seashore aggravation, and exertion. In case of causticum, dry cold winds and clear fine weather is not tolerable. Naxvomika is cold, stimulants, and morning aggravation. Lachesis, sleep aggravation, especially on waking in morning, and aggravation by heat. Pulsatilla, warm room, rich food aggravation, and ignitia, emotional coffee and tobacco after having this aggravation. Thermal state, Staphysagria chili, natamute hot patient, causticum chili, Naxvomika chili, lachesis hot patient, Pulsatilla neither chili nor cold, sometimes chili, sometimes hot, ignitia chili. Constitutionally, the Staphysagria is lean, sensitive, and refined in character. Appearance. Natamute thin, emaciated, neck is emaciated. Causticum weak muscle and stooped. Naxvomika thin, nervous, dark hair. Lachesis dark, intense, excitable. Pulsatilla blondie, soft, fair, gentle, good looking. Ignitia nervous and delicate. Miasmatic background already I have told you. The Staphysagria mostly sorapsychotic, natamute soric, causticum psychotic and syphilitic, Naxvomika soric, lachesis sorasyphilitic, and Pulsatilla soric, and ignitia soric. Now I want to express within 5 minutes the case at the single case, and then I will explain the other cases in the next session. Let me say please at least one case. The preliminary data, the patient is female and 45 age, 10th standard education, occupation housewife. Background, patient was apparently healthy 3 years ago, but she noticed that there is a ballooning like swelling in the umbilical region which started increase gradually. He consulted allopathy doctor, got operated, that is the umbilical hernia. The post-operative scar is not getting healed, took antibiotic tablets for 45 days with not satisfactory result. She also had a problem of sleeplessness, can't sleep the whole night, feels sleepy when it is time to wake up, sleep disturbed due to thoughts about children's future. Now, personal history, appetite good, desire sweets, non-veg, fatty food, fruits, aversion, nothing significant. Bile habit once a day, bladder habits, dark yellowish urine 5 to 6 times per day, and perspiration profuse in the axilla and scalp, sleep disturbed due to thoughts, thermally hot patient. Menstrual history, hysterectomy done. Mental general sensitive, cries easily, especially when someone denies her. When work is assigned, it has to be done in exact time and exactly how she likes. Want of attention and care, childish nature, cheerful, alternating with gloomy mood, cannot tolerate the slightest change in the weather irritability, physical general examination, moderately built and nourished, no signs of Pillars, cyanosis, lymphadenopathy. Now this is the just after operation, after 1.5 months later, it is the scenario of the after operation of the abdomen. Most of the heal, but part of the portion is non-healing ulcer and pus is discharged. Then on the totality of the symptoms, there is a after repatriation, the Naxvomika, Staphysagria, aconite, calendula, calculator curve is coming, and I have selected this one, Staphysagria 201 dose. Next day onwards, rubram BD for 1 week. Then this is on 13th June. Wound healing better, swelling better by 50%, slight pus discharge still remaining, and C+ complaint same as before. All the other journals are good. So under considering all these symptoms, the power Staphysagria 1M1 dose given, followed by after 2 weeks, calendula is given. If the pus discharge is still remain, that's why calendula is a very good drug after operation if the pus is discharged. after Staphysagria, I have seen if not properly healed and pus formation is there, then calendula is the remedy. So next drug is calendula. So you see that on July 4th, the almost ulcer is healed up. Sir, shall I continue?
Just 5 minutes remaining.
Achha, okay, sir.
You
I-
if you,
I-
you
I
can
have
continue,
started.
sir.
Yes, sir, I have
Because
started late. Yes, yes.
yes, we have another day also, so it is better to continue.
Okay. So now I explaining the case 2. Then I will stop. There are so many cases. I will explain in the part 2 webinar. Okay. Next, preliminary data is the patient is aged 50 years, gender male, and married, and address in Hyderabad. Present complaint is white scaly eruption on scalp and hands for 4 years. Then history of presenting complaints. The patient was apparently healthy 4 years back, but problem began with severe itching on the scalp and extended to the arms with white scaly eruption and no discharge. The itching is aggravated at night on perspiration in the winter and ameliorated by scratching. In the summer season aggravates, burning follows scratching at the site. In the family history, there is no skin disease. Everything appetite normal, vital information is right. Thirst 3 to 4 liter, desire salted food, spicy food, aversion nothing specific. Addiction, cigarette 2 per day, but previously it was 10 per day. Now doctors advised, and I also advise not to take cigarette smoking. So gradually he is reducing the per day cigarette smoking. Bile habits, heart stool, passes once every 2 days for many years. No bleeding per rectum, perspiration profuse all over the body. Mental general, patient is emotional, anxiety about future, and there is a evidence of silent grief. The patient's family members are not taking care him properly. Ailments from indignation, grief, and suppressed anger. And the patient is not so intellectual. He is only 4th standard education and dreams nothing specific. Then then the integumentary system examination, the skin examination, that is distribution on the extensor surface of the bilateral forearm and the scalp. Color is white, size varying, configuration irregular, surface dry, scaly, well defined and sharply demarcated. Discharge, no abnormality seen in the nails. Palpation, candle grease sign is positive and auspicious sign was positive. And that this is a diagnosed as a plaque psoriasis. Clinical findings well defined and sharply demarcated, symmetrical, plaques covered by dry silvery scales, eruption on the extension surface of the bilateral forearm and the scalp with itching. Now the symptoms are taken: mind grief silent, indignation, mind anger elements suppressed from, mind anxiety future about, mind forsaken, feeling beloved by his parents, wife and friends, feeling of not being, mouth speech is stammering, stomach thirst is large quantities, rectum constipation is there, heart stool, respiration, mental exertion, aggravation, skin eruption scales, skin eruption itching, night, Jail's food and drinks, highly seasoned food and desserts, jail food and drinks, salt desserts. So probable remedies after reparation, the natamure, Staphysagria, sulfur, and phosphorus. Considering all the symptoms which are not taken in the reparation, the totality of the symptoms, patient's personality, considering all these, I have prescribed Staphysagria 200, 1 dose. Then the next follow-up, the that on 25th September, itching decreased by 50%, new patches developed over the right lower extremity, and the sack is given. But after the second follow-up, no new complaints, itching decreased by 60-70%, boils regular. Then Staphysagria 0/1, 2 medicated globules of number 10 to be mixed in 100 ml distilled water and add 20 drops to be taken once full medicine every 2 days intervals. Next, review on the 20th November, no new complaints, boils regular, itching decreased by 90%. So this is the before treatment, just when we are treatment started. This is the picture in the right side after treatment, before, this is after, this is before, this is after. So sir, now over to coordinator, sir.
Yes, thank you, Professor Samar Mukherjee, sir. It's sorry,
Chatterjee.
Samar Chatterjee, sir. It's really an excellent session indeed. And unfortunately, due to some network failure
Yes,
from
sir.
the beginning, so there was some disturbance. Anyway, we will continue the session without any break also tomorrow. At the same time, hope all of you will join the team tomorrow at the same time at 8:30 p.m. itself. As we know that the Staphysagria is one of the remedy that will be very useful in all conditions, whether it be an acute or a chronic, it doesn't matter much. It works wonderfully, and we have a lot of successful cases in our kitty, and most of the homeopathic doctors get such cases. It is tomorrow during the presentation. All of you can say something about your experience in this particular field, because how effective Staphysagria in your experience. So I am.
Thank you, sir.
Anyone is, I am inviting, since there is no time for discussion, I am inviting Dr. Neha Kakkar to say a word of thanks to the session. So, sir, please say a word of thanks to the session.
Thank you, Dr. Dhaneji, and congratulations, sir. Samar Chatterjee, sir. Very
Yes, sir.
nice. Excellent session. Staphysagria medicine.
Yes, sir.
Very good explanation of Staphysagria medicine. Staphysagria is a wonderful medicine. Pride, insult, envy, जो है etc. Anger suppression, after insult suppression, any types of suffering disease, and after sexual suppression, post-surgical etc. So very nice, excellent session. Behalf of IFPH, whole team, very thanks, sir.
Thank you, sir.
Thank you.
Thank you all, sir. Thank you all, sir.
Thank you.
Thank you all, sir.
Yes, once again, I am inviting all of you to join the celebration of 5th anniversary celebration of IFBH to be conducted on 28th September. That is coming Sunday at Cochin Vivanda, Touch Vivanda, and it is there will be a grand inauguration by our Honorable Sri Jadhav Pratap Rao Ganapatra. That is the Aish Minister. Central Aish Minister. So hope all of you will join us tomorrow and the same time. Thank you all once again. Thank you, Professor, for this session.
Thank you, sir. Thank you, sir.